Assalomu alaykum do'stlar, yaxshimisizlar? Tuzimisiz? Do'stlar, bugun Fordis больницада qonni orqasiga doktor Rahmat borgab aytadi. BMT departamentidan nima kasallik bo'ladi, shu qon orqali qon kasallar bo'ladi, shularga любой narsasiga nima kasallik bo'ladi, qon narsalarga 3 ta 4 ta etaji bo'ladi. Ukol dorisi ham bor, operatsiyalar ham bor. Qolgan videoni men hozir YouTube'ga qo'yaman. Videoni oxirigacha ko'rasiz. Hamma ma'lumotlar ichida bor. Doktorlar nima bo'ladi, qolgan больницаlarga bitta doktor bo'ladi shu narsa uchun. Lekin Fordis больницада 12 ta doktor bo'ladi shu departamentda. Hech qanaqa больницаga bunaqa apparatlar, bunaqa doktorlar bo'lmaydi. Videoni oxirigacha kuzating. Rahmat. Sog' bo'ling.
It is like highest in North India, as you don't know the numbers from CMC Vellore. Otherwise, we would have said that this is the highest in the country. But the journey does not stop here. Neither you serving your own people, and as Indians, we serving the people from Iraq and other places. Hello. As a team, many new centers have come up, and many more new centers will come up. But what is the unique point for Fortis? One is the team. So we have got now 12 people. How many people? 12. If you go to our neighbor hospitals, how many they have? 1 or 2. So where will you have a trust? Your patient should have a trust where? There's a pediatric team separate. There are 4 pediatric hematologists. Dr. Meet is doing a phenomenal work. Dr. Pallavi is there. Dr. Santosh. Now there's a geneticist which is joining in. Geneticist, what is genetic? All the problems in this life comes from our genes. Geneticist from Kashmir is joining with us. Specifically. Then there is a geriatric guy who's joining with us. And there's an infectious disease specialist already there with us. So you can trust a team rather than an individual. That's the motto. Second, this transplant team over 6 years have done almost 800-900 transplants. Every year we do 200 plus transplants. So you see, the trust also increases within the patients. Somebody will say less amount, somebody will say cash, somebody will say, but how much 2-3% even you get a more cash? If the patient life is saved, what is more important, dua or money? Ideally is both dua and money should come together.
Yes, sir.
But certain times only dua can come.
Yes.
And there will be slightly less money. So there are people in this town who will say, okay, no pay, don't pay GST, we'll give you cash. So my simple message to all of you is, when it comes to patient life, what is more important? 3% money extra or patient's life?
Patient's life.
That we have to all discuss. We have to all see in our hearts that this team who's doing a phenomenal job need to be supported by you. And not for us, and not for Fortis, but for the patient welfare. Because transplant patient last year, success rate has really gone up. In pediatrics, it's almost touching 80-85%. Adult side, it is touching 70-75% in leukemias. And we are embarking on new things, multiple sclerosis, systemic sclerosis. So one of our friends did got a multiple sclerosis patient, which nobody else is doing. Nobody else in the whole country. Remember one word called multiple sclerosis and autoimmune disorder. This year, we will do 100 transplants for MS and systemic sclerosis with your help. You have to spread the word that bone marrow transplant is available for systemic sclerosis. So my humble request is, believe in the team, believe in the indication. As a group, I would request to spread a word called thalassemia, that every thalassemia should get a bone marrow transplant done. And you know what? The amount of money which Kurdistan government spends doing a transplant in Kurdistan through Italians is same as what we do in Fortis. So if somebody says in Kurdistan it is done in less, no. It It is at the same price of what we are doing, or slightly more. Their paper they have just published from Lawrence Faulkner, talking about $30,000 for a transplant in Kurdistan. And how much we are doing it? $25,000. So we are even cheaper, $5,000 to the government. You see?
Wonderful.
That's a word which you have to spread, the positive word. The more you talk to your friends, the more people take it to the other places. You have to speak to them. You have to tell them the great work which is happening here. So I would request every one of you to help us grow this to 300, 400 transplants. This year, inshallah, we will do 300 plus transplants. Which means one transplant every day will happen in this hospital. Which is already happening. In 23 days, we have done 20.
I said we wish the best for all.
Yes. So I think, my friends, it's a great opportunity to learn. Do not get swayed by any cash or any differences the other hospital tells you, because the team is here. You have to trust the team, because that's by the end of the day when you sleep, that's what it goes, how trustworthy you have been to your own patient. How our patient can trust us is what defines us. So thank you once all. I will ask Dr. Meet and then Sir can speak. But thank you everybody from the bottom of our heart for helping us, supporting us, reposing your faith into us and into this program. And every single individual in this team has done a remarkable job. And it's not me, it's my team, it's our team. It's us, it's we, it's not I. So I'm nothing. So believe me, Dr. Meet is better than me. Dr. Pallavi is better than me. Dr. Vikas is better than me. This time I'm just a face to you. So over to Dr. Meet.
I think the similar things, no much difference. It's just that the trust is important. So you keep the trust, and if there is any lacunae that you feel that this is not getting addressed, please directly talk to one of us. That is the most important thing. Anywhere, any problem, any lacunae, any issue that is not getting resolved, there the benefit of team is that you get answers. If one person is not there, there are more people for the answers. That is the benefit. For the answers that you may have, the questions that you may have, the questions that the patients may have, the questions that the 100 relatives of the patients may have. So if there are 1,000 questions, there are people to address those questions. That is the important thing, and that is how the trust is done. So anytime, all of us are there for the patients. That's it.
Sir. Well, first of all, good afternoon, good morning to all of you. See, the thing is that you will all agree that all of us ultimately have to give answer to one person, that is God, Allah.
Yes.
Ultimately, we have to give him answer. So, your job and our job should be in the same line, that we have to do best for our patient, best in the world. Now, when we do best in the world, then there will be price difference between this hospital and that hospital. For example, we do RF ablation of atrial fibrillation, which hardly anybody else does, and if they do with the inferior technology. They don't use the latest technology. They quote the less price, but patient doesn't know. You don't know. You say this hospital is cheaper. So whenever some hospital gives you a cheaper option, please come back and discuss with me as far as the heart is concerned, because I want to ask them that what they are going to use, what technology they are going to use. At least we can make it clear. But yes, if they want to use the same technology, same application, same clinical success, then I'll agree, okay, you go to a cheaper. But most of the time it is a pseudo cheap. It's not a true cheap. They do inferior job, inferior strength, they can reduce the cost. So it is very important for us, as he said already, Dr. Rahul, that we have to see the capability of the team, not only one person. Because say I can take leave 15 days, I go to USA, somewhere else. Who is going to see the patient? If I don't have a team, so in my team, for example, we have 8 cardiologists. 8, not 1 or 2, 8 cardiologists. We have 2 cardiac surgeons. So even if somebody goes away, some on leave, there is always a team to see the patient. I would also go further that we should develop a system for foreign patients in cardiology particularly, because they have to, show us again after 6 months or 1 year. After 6 months or 1 year, we can arrange a teleconsultation, and we call only those patients who need something to be done. We don't call others. Don't waste their money, don't waste their time. And I can tell you one thing, that in cardiology we do every procedure in the whole world. Except we can't do transplant for foreign patient, it is still not allowed. We can do LVAD, we can do everything else. In interventional cardiology, in cardiac electrophysiology, we have everything new. So any time if there is any kind of query clarification or there is a misunderstanding, you please come to me, my office will make it clear. It's very important what he said. It's a team work. One person can't do anything alone. It's not possible. So we have tried to develop a team. We are trying to develop the departments. Here are department of hematology with 1, 2, 3, 4, 5 different specialties. Same here in my team. Every doctor cannot do everything.
How will the good message will go that these are the diseases which can be cured by doing a transplant? Did you know that multiple sclerosis can be transplanted? Not.
I did know.
Not many people. Not many. 90% people don't know.
Cardiologist doesn't know. So you have to tell my dear.
So I think it's very, very important to remember multiple sclerosis. Remember systemic sclerosis. These are autoimmune disorders. Dr. Meet has done in India first 7 patients in India. Systemic sclerosis. Develop brotherhood amongst us.
I'm from Mazar Sharif.